Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. This week's quick video is discussing childhood headaches. Now, as we are going into the school season and you start seeing these signs all over for flu season, get your shots, doing all of this, let's just talk about some basic concepts such as a headache. Childhood headaches have been on the rise over the last 10 years, and this week's handout in the office talks about how to address these potential issues and also how to recognize them. One of the side effects of having headaches in a lot of youngsters is, well, actually even in older people, is not sleeping well. And when someone is not sleeping well, you go a few nights with 3 or 4 hours of sleep, you might start to notice your attention span, maybe a little attention deficit going on, a little restlessness, things like that, simply because of the headaches. And also, headaches can keep us from, really expressing ourselves and in being who we really are because of the throbbing, pounding pain. Or, you've probably experienced it. Ice pick kind of behind the ear into the base of the skull, coming up through your eye, sharp shooting pain. And now imagine your child or someone's child, nephew or niece, suffering from this type of predicament. Now, medications can help with these things. As a chiropractor, we're always looking at what are some manual type therapies that can be done to help reduce headaches or possibly even eliminate them. So when thinking of a headache in a child, or even an adult, but specifically this week is talking about children, looking at the upper cervical spine and the lower cervical spine, but mainly in the upper area. We have the occiput, which is the base of the skull where your cerebellum sits. The cerebellum is a part of the brain responsible for balance and coordination. Take somebody on the side of the road who's standing there and being asked to do this. And the reason why is they're checking cerebellar input for balance and coordination, which alcohol obviously has an effect on. So if we have muscle tension in the suboccipital muscles, those are the muscles below the occiput. They are about the size of your pinky finger. And when you think about it, there are more proprioceptive fibers in the suboccipital muscle than in a quadricep muscle. So quadricep obviously being much, much, much larger, but the responsibility of the muscles up here and behind the neck. And think about it, we're on the computer all day, we're sitting in front and we're looking up at it. Hopefully we're not leaning forward. Hopefully we've got the monitor high enough. Our kids in school now, it's like, oh, they get an iPad. That's great. Although if you look at the iPad and being on a desktop or looking down at it, that is not very biomechanically sound for our bodies. We weren't, first of all, designed to sit all day, and we definitely weren't designed to sit and stare at a screen all day, which I'm doing right now. But with that being said and done, as a chiropractor, we're going to check the upper cervical region. Obviously, we're going to check it all. But we want to make sure that that is functioning well, and a couple adjustments to the upper area. Clearing those things out, and it can be amazing to watch a small child who used to have headaches. Now they're sleeping better. Some of the side effects also, even the bedwetting and issues like that we see in children. So if you think your child may have an issue with headaches, or if they're having neck pain and tightness, some of the backpacks, my kids, their backpacks at school, my daughter comes in this morning, she had her clarinet in one hand, her lunch pail, and actually in that same hand, carrying them both, her backpack, which probably weighed 40 pounds, and all I'm thinking is, well, I should do something about that, but for now, at least she's adjusted. So obviously, food, eating habits, and all that are going to play into this, but looking at it and thinking of areas in the neck that are locked up, causing pain and tightness and restriction. So wherever you're at, if you have a chiropractor in your area, please see them regarding children and headaches. All right, thanks. Have a great week.